So this is how you actually swab. I don't want to do this, but I'll do it for you. How do we insert this? How deep do we insert this? What angle do we insert this? People get this so wrong. I think people don't understand the anatomy of the nose. So the nose in your head that you have right now doesn't actually go up. Your nasal passage, where your air flows, where there is actually a space for the thing to go in, because it should go, it's meant to go to the top of your mouth at the back. So if I were to get it in deep enough and I were to look up high enough, you should be able to see this at the back of my throat and above my tongue. But people tend to do this. They tend to use this angle, which is actually very inaccurate because that's not where your nose goes. If you continue to push up, you're going to go into something called a brachial plexus, which is actually just a bunch of blood vessels and nerves, which is going to be more painful. So the way you're supposed to do this is that you are supposed to obviously keep this very clean. You then blow your nose to get any gunk out of it. And then the angle you're supposed to use is an angle that goes in line from your nose to your ear. So you see how long this is, all right? If I stick it in like this, that's terrible. I've hit the back. You see the angle that it's in? It's flat. It's not up. If you go up, you're going to hit a brachial plexus. Oh, it feels terrible. Then once it's in, you're meant to actually rotate it. I'm not going to do it because it feels terrible. You're meant to rotate it 3 times because now you're getting cells and tissue, and then you obviously pull out. And that is actually how you swab. If you found this helpful, I would appreciate a like and a share and a subscribe because, I mean, that's dedication to the cause.